Welcome to today's lecture. Our topic for today is the osteology of the neurocranium. So the bony configuration of the head is referred to as the skull, and the skull can be structured into two regions, and these are the neurocranium and the viscerocranium. This is the neurocranium, and the lower part here is the viscerocranium. Neuro from the word neural tissue. It means that this region encloses the brain tissue. While the lower region, visceral, means there are organs that are situated or located within this region, which can be the sense organs, the eyes, the nose, the tongue, and so on. So you have the facial skeleton constituting those structures within this lower part. So the entire skull region can be divided into two. We have the upper part, which is called the neurocranium, and the lower part, which is called the viscerocranium. Our lecture for today will be limited to just the neurocranium. So we would be looking at the bony configuration of this region, the types of bones that constitute the neurocranium, and some other events that we have around this region. We can define the neurocranium as a collection of bones that are joined at sutures. So we have sutural points. They're actually patches of bones that are joined together at a point called the sutures. So at the end, these patches of bone come together to form a rounded, like a ball-like appearance, which encloses the brain tissue. So we try and look at what constitutes this neurocranium, also some form of transformation that we have within them. But let's take a look at the functions. The first function I would like to highlight here is protective function. The neurocranium protects delicate organs. We have said that it encloses the brain tissue, and we know how delicate the brain tissue is. It needs to be well protected and guided. So the neurocranium helps to protect it or houses it. It also helps to give shape to the head. They also help to provide sites for muscle attachments. We all know that we do not carry our neurocranium all around. The neurocranium is well padded by muscle fibers and also overlaid with skin. So there are points on it where muscles are attached to. It also contains sinuses. Sinuses are spaces within the bone tissue. And during the course of our lecture, we will see the full description of what the sinuses mean. These sinuses helps to reduce the weight of the skull. They also help to increase or enhance voice resonation. So we may not need to use a microphone when we need to increase the volume of sound that we produce. With the assistance of the sinuses, voice can be projected in higher pitch as we want without the need of a gadget. They also contain foramen responsible for the passage of vessels. We have said that the neurocranium encloses the brain tissue. That means it is within it that the brain tissue is located. And of course, we know there are nerves that emerge from the base of the brain that needs to send innervation to structures down the body. Without this foramen, these nerves will not be able to pass through from the skull to go down to the organs for them to innervate and carry out their neural activities. Foramen are like holes that are created within the skull. The neurocranium is made up of 8 bones, where 2 are paired and 4 are unpaired, making it a total of 8 bones in all. So we have the frontal bone, which is an unpaired type of bone. We have the parietal and the temporal, which are paired. And this means that we have 2 of them. We have one on the right and we have the other on the left. We also have one occipital bone, which means that it is unpaired, hence it is one, and we have just at the back of the skull. And we have the ethmoid and the sphenoid bones, which are both also unpaired. It means we have just one of them. These two bones are located at the base of the neurocranium. As we follow suit with this lecture, we'll be able to understand the configuration of these bones, what they look like, where they are located, and also some of the transformations that they present. So the first one we'd like to talk about is the frontal bone. From the name frontal, it means it is located at the front. So it is a single type of bone. You see it around the forehead region, but this bone definitely will be forming contact with the surrounding bones, because we say that the neurocranium is a collection of patches of bone. The frontal bone cannot run through the entire neurocranium. It does not have the mass to do that, or the capacity to do that. So it will be connected with some other type of bone for it to complete that rounded pattern that they need to create. So they are connected with the parietal bone at the back. This is the parietal bone. If you look at this image downwards, this is the parietal bone at the back, and this is the frontal bone. And inferior to the parietal bone, we have the temporal bone. So this is the temporal bone around this region. That means that the frontal bone needs to make a connection with both the parietal bone and the temporal bone. There are specific names also given to sutures that tend to connect these bones together. So the name of the suture that connects the frontal bone to the parietal bone behind and the temporal bone more inferior is called the coronal suture. So this is the coronal suture here. So this suture connects the frontal bone to the bones that are located posterior to it. And these are basically the parietal bone and the temporal bone. The frontal bone is made up of three parts. The first part is the squamous part, and this is the largest part. Squamous means thin. So the squamous part is the topmost part. Then more distal to that, we have the orbital part, which is the part that forms the supraorbital margin. That's the high region, one on the right and one on the left. While in between the orbital region, you have the nasal part, which is the nose region. So the orbital part of the frontal bone presents some form of structures that are also worth to be highlighted, like the supraorbital foramen. This is the supraorbital foramen. So we have the supraorbital foramen. The supraorbital foramen transmits the supraorbital nerve, which provides sensory innervation to structures located around the forehead region. So it is located at the superior-medial part of the orbit. The superior-medial part means the superior. This is the entire superior region, but medial means it's closer to the median plane. So it's around this region. So this is the supraorbital foramen that transmits the supraorbital nerve. The supraorbital nerve is a branch of the frontal nerve, which is a branch of the ophthalmic nerve. The ophthalmic nerve is the first division of the trigeminal nerve, which is the cranial nerve 5. Then the nasal part is located between the two orbital parts. Also more on the frontal bone. The frontal bone on the inside, when you remove the skull cap above, what you see on the inside, you see a median eminence or a bridge that is called the frontal crest. This frontal crest is seen around the midline in the anterior part of the frontal bone, and this is the structure here. It's like an elevation that tends to shoot out. And what this does is to create attachment sites for the vas cerebrae. The vas cerebrae is made up of folds of dura mater. The dura mater is one of the layers of the meninges that actually covers the brain. The brain is not just kept within the cranial cavity, that's the skull. They have a protective coat through their entire surface. This is just in a way to further protect them. We've said that they are very delicate and they need to be well protected. So one of the layers that is called the dura mater form this vas cerebrae. The vas cerebrae, what they do is that they tend to separate the two cerebrum hemisphere. So the attachment site of this vas cerebrae is on this frontal crest. This is just to further hold it in place. We also have the frontal sinuses. We talk about sinuses when we also discuss about the functions of the neurocranium. We say that there are spaces within the mass of the bones that forms the neurocranium. And of course, they take the name of the bone that they are embedded. Because we have this space within the frontal bone, We call it the frontal sinuses. So we have two, one on the right and one on the left. Then the second bone we would be talking about is the parietal bone. This is a paired type of bone, and they are quadrilateral in shape, which means that they are somehow four-sided. This is the right parietal bone, this is the left parietal bone, and this is the suture that tends to join them together, and this is called the sagittal suture. The parietal bones form the roof of the neurocranium. You can see them on top. This is like the aerial view. You see it on top. They form the roof, and they also form the side of the neurocranium. But the side that they form is the upper part of the side of the neurocranium. The lower side is formed by the temporal bone. We soon get there during the course of this lecture. So the parietal bone forms the roof and the upper side of the lateral wall of the neurocranium. So the temporal bones are also two. From the name tempo, it means they are located around the temporal region by the side. That is where they are located, but they are located distal to the parietal bone. You have the parietal bone somewhere up here, then distal to the parietal bone, around the temporal region, you have the temporal bone. They are bilaterally symmetrical, which means that they are the same on both sides. So you have one on the right side and one on the left. We said that they are situated below the parietal bone, which means that they form the lower part of the side of the neurocranium. The temporal bone, of course, by now we should know that it will have a connection point with the parietal bone. So there must be a suture that will be connecting them together. And the name of the suture is the squamous suture. The squamous suture connects the parietal bone with the temporal bone. The temporal bone can be subdivided into two parts. We have the squamous part and also the pectrous part. The squamous part means that it is thin. We've said this before, that when we hear squamous, it means that it is thin. Then we have the pectrous part, which means that it is the hard part. So this upper part is the squamous part, and this lower part that looks thickened, that forms the most distal region, is called the pectrous part. On the squamous part is thin. On the pectrous part, we have a lot of transformation within the pectrous part. This transformation basically are to allow the temporal bone to connect with structures that are located around this region. So they tend to create different kind of transformation here so that they can link with structures downward to form a complete skeletal system. So we try and look at those transformations one after the other. And the first one would be the zygomatic process. The zygomatic process is like a finger-like extension that is created by the pectrous part of temporal bone. From the name zygomatic process, we should know that this has to do with the zygomatic bone, which forms part of the viscerocranium, which we'll be talking about later in our next lecture. This is the zygomatic bone. But in a way of connecting with it, the temporal bone has decided to create an extension to link to the zygomatic bone. So this is the zygomatic process of the temporal bone. They also allow for the attachment of muscle. So you can see that this is one of the transformations that the temporal bone has created. The second transformation that I would want to highlight is the styloid process. The styloid process is a long pointed extension around the pectrous part of the temporal bone. And what this does is to anchor the tongue and the pharyngeus muscle. If you go back to our lecture on the pharynx, we mentioned that one of the longitudinal muscle that forms the pharynx is the stylopharyngeus muscle. And the stylopharyngeus, we described that it originates from the styloid process of the temporal bone, and its fibers runs down to be merged with the bulk of the pharynx. So this is the styloid process that we talked about in that lecture, and it is one of the transformations that is seen around the pectrous part of the temporal bone. We also have the mastoid process. This is like a rounded eminence, and this creates attachments for muscle. If we remember our sternocleidomastoid muscle, this is one of the muscles that form the posterior triangle of the neck, the sternocleidomastoid. So this is the attachment point. Then we have the next one, the external auditory meatus, which is where the ear opens into, and it is also around the pectoral part of the temporal bone. So this is the opening for the external auditory meatus. Then the last one is the mandibular fossa. This is like a depression for the condylar process of the mandible. And this is where the temporomandibular joint is formed, where the mandible fixed its head into to form the temporomandibular joint. You can see that in the pectoral part of the temporal bone, we have transformation to suit the different functions that they exhibit. The occipital bone, this is the backbone. It is located at the posterior part of the neurocranium. It also helps to form part of the base around the posterior region of the neurocranium. So they tend to curve around themselves, thereby creating a form of hollow dish. So they do not only run through the posterior part of the skull, the part of them also extend towards the base of the neurocranium around the posterior part. The occipital bone would be connected to other patches of bones that form the neurocranium, and where they connect with the parietal bone is called the lambdoid suture. They also present some form of features. We have the foramen magnum. Remember when we talk about the foramen within the cranium, the largest foramen that we have in the neurocranium is the foramen magnum. And from the name, magnum means it has magnitude. So this is like the largest opening, and it is seen around the occipital bone, where it's curved around itself towards the base of the neurocranium. That is where you see this opening, the largest opening through which the spinal cord passes through. Then we have the occipital condyles. Occipital condyles are seen like a swelling both around the foramen magnum. This occipital condyle are rounded projection, and it is created for the articulation with the atlas, which is the first cervical vertebra, which forms the skeleton of the neck. So this is where the first cervical vertebral bone connects to. This is the occipital condyle. Then the next bone is the ethmoid. Even though the ethmoid is embedded within the cranium, there are no bones that you see when you check the outward configuration of the neurocranium. They are embedded within it. They will still be classified as part of the neurocranium. So this is where you see the ethmoid bone. You see them forming part of the base of the neurocranium. They're embedded within. But because they still form the entire circumference, they will still be classified as the neurocranium. They have a very light weight because they are seen with a lot of sponginess. They have holes and spaces within them. By the time we discuss about their morphology in our next slide, we see why this is so. So you see them between the two orbits and above the nasal cavity. So we can still classify them as part of the bones that form the neurocranium, even though they are not seen on the outside. Let's look at the morphology of the ethmoid bone. The ethmoid bone is seen to present different structural pattern of features, and this is what this slide will be unfolding. If you look at this region here that is harrowed in red, this is the cribriform plate of ethmoid. This cribriform plate of ethmoid runs transversely, and it is seen to border inferiorly the nasal cavity and superiorly the cranial fossa. So inferiorly here we have the nasal cavity, while above it we have the cranial fossa. And if you look through the cribriform plate of ethmoid, you see that it is seen with a number of foramina. These holes are created to allow for the passage of the olfactory nerve rootlets. We know that the olfactory segment of the nasal cavity is located at this upper edge. And this olfactory nerve will need to exit the nasal cavity through these holes created on the cribriform plate of ethmoid so that they can access the cranial fossa, where their sensory impulses will be relayed onto. So that is the essence where we have this piercing on the cribriform plate of ethmoid around this transverse plate. So you have this presentation creating like a sieve-like appearance because of the holes that are created on it. So this is one of the features that the ethmoid bone presents when we try to describe it as a lightweight bone. This is one of the characteristics that helps to
support this feature. So if you look at the cribriform plate of ethmoid, superiorly there's an extension that is referred to as the crystal galley. This crystal galley will extend into the cranial fossa, and this is where it will be helping to create structural support or point of attachment for the fat cerebri. Remember also when we describe the frontal bone, we said that the frontal bone has a frontal crest that also creates attachment for the fat cerebri. And this is where the frontal crest and also the crystal galleys provide structural support for the structure, which is the brain tissue that is located within the cranial cavity. So this is the kind of presentation that you have as a superior extension from the cribriform plate of ethmoid. Superiorly from the cribriform plate of ethmoid, you have the perpendicular plate of ethmoid bone. This perpendicular plate of ethmoid is seen to run inferiorly from the cribriform plate of ethmoid, and this is what is carried here in blue. This is seen to form the superior two-thirds of the nasal septum, and it is seen to form the superior two-thirds of the bony part of the nasal septum. We know that the nasal septum is formed by a cartilaginous structure in the anterior part and a bony structure in the posterior part. The superior two-thirds of the bony structure of the posterior part is formed by the perpendicular plate of ethmoid, while the inferior one-third of the bony region is formed by the vomer. So you have the vomer coming inferiorly, where it meets with the perpendicular plate of ethmoid here to then form the complete partitioning of the nasal septum. And this is around the bony part. So this is the configuration that you have from the cribriform plate superiorly extending as the crystal galley. Inferiorly, an extension is created as the perpendicular plate of ethmoid. And if you look on both lateral side of the perpendicular plate of ethmoid, you have the ethmoidal labyrinth. The ethmoidal labyrinth is what is located on both sides. You have one on the right and you have another one on the left. The ethmoidal labyrinth is seen to have the ethmoidal hair sinus. This ethmoidal hair sinus is then sandwiched between the medial plate and also the lateral plate. This is where we have the medial plate here that is directed medially, and you have a lateral plate here that is directed on the lateral side. So in between these two plates, we have the ethmoidal hair sinuses, and this is what is highlighted here in black. So you see these sinuses created as spaces within the ethmoidal labyrinth. This is also one of the features that helps to contribute to the light weight of the ethmoidal bone. We say that the ethmoidal bone is light-weighted when compared with other neurocranial bones. These are the features that contribute to these characteristics. Remember when we described the cribriform plate of ethmoid here, we also described that this cribriform plate is also seen with foramina. So all these holes that are created on the ethmoid bone are responsible for the light weight of this bone. So you have the ethmoidal labyrinth on both sides, one on this side and the other one on the other side. And if you look deep into the medial plate, you see that you have two projections. You have the superior conchae and you have the middle conchae. These two conchae are seen on the medial plate or medial wall of the ethmoidal labyrinth. And this is where they will be forming the lateral wall of the nasal cavity. If you look at this image at this inferior region, this structure that is harrowed in green is the ethmoidal bone. And if you look at it, this configuration up here, you see that the space that is created between the perpendicular plate of ethmoid that is seen to form the nasal septum and also the medial plate here where we have this projection is where we have the space of the nasal cavity. So you have one on this side, you have the other one on the other side. So this means that the lateral wall of the nasal cavity will be formed by the projections that you have on the medial plate of the ethmoidal labyrinth. And this is what is seen here in this image. So you have these projections created as the superior and the middle conchae. And this is what is presented here in this image.
The next bone is the sphenoid. The sphenoid also in terms of location is somehow related to the ethmoid. They are also located around the base of the neurocranium. So these bones, even though they form part of the basal configuration of the neurocranium, we still classify them as part of the bones that make up the neurocranium, even though we don't tend to see them on the outside, like the frontal bone, the occipital, the parietal, and the temporal. They are embedded within. So the sphenoid bone, I call it the most beautiful of them all. It is an unpaired type of bone, which means that it is just one. It is a butterfly-shaped bone. You can see the structure here. It has a body, it has wings, and it has limbs. So it's very beautiful in terms of its configuration. So let's go to see what they actually look like. So the regions, the first region is the body, and this is like the central part. It's also referred to as the corpus. So it is the central part, and this central part, within it, we have a sinus. So we actually have a sphenoidal sinus too, which is like a hollow space that's located within the sphenoidal bone. So within this body region, we have the sphenoidal sinus. On top of the body, we have an indentation on the roof that tends to accommodate the pituitary gland. So this bone creates accommodation site for the pituitary gland, and the indentation that is created is called the hypophyseal fossa. This hypophyseal fossa is an indentation that is created on top of the body of the sphenoid bone. And this indentation creates accommodation site for the pituitary gland. We know what pituitary gland does. We can go and read up on that to expand our knowledge. Then we have the wings. We've described it as a butterfly-shaped bone. The wings can be classified into two. We have the lesser wing and we have the greater wing. The lesser wing, from the name, means is smaller, and we have the greater wing, which means it's bigger. So this is the lesser wing, and this is the greater wing, which is a bigger wing. Then it has pterygoid processes. The pterygoid processes are the foot processes, which are the limbs through which it stands on. So there are also two. We have the medial pterygoid plate and we have the lateral pterygoid plate. So this is like the limb of the sphenoid bone. The greater wing of the sphenoid, because it's greater, is bigger, it's run outside the space where the sphenoid bone is contained. Even though this bone forms the base of the cranium, part of it is still extend to the outside. And the part that extends to the outside is its greater wing. That is a bigger wing. So it tends to run outside the space of the sphenoid bone. So you see it forming part of the neurocranium on the outside. This is the temporal bone. This is the parietal bone. This is the frontal bone. We've said that the ethmoidal and the sphenoid bone tends to have a similar presentation in terms of where they are located. We said that the ethmoid and the sphenoid are both located around the base of the neurocranium, even though part of the sphenoid bone, which is the greater wing of sphenoid, extends to the outside, but the bulk or the majority of the sphenoid are embedded within the base of the neurocranium. Let's look at how they tend to relate with each other. The ethmoid, we say that is located above the nasal cavity between the two orbits, and posterior to the ethmoid bone is where we have the sphenoid. So the sphenoid bone is actually located behind the ethmoidal bone. In the sutures, we've said that when we define the neurocranium, we say that they are a collection of patches of bones that join together at sutural points. The sutures are more seen in newborn or in infants. So we'd like to talk about some of the unique points that these sutures have presented during the course of trying to join the patches of bones together. The bregma is a point of intersect where the sagittal suture meets with the coronal suture. Remember, we talked about the coronal suture separating the frontal bone from the parietal bone. And we have the sagittal suture separating the two parietal bones. These are the two parietal bones. This is the frontal bone. So the median point, or a point of intercept, where the sagittal suture meets with the coronal suture at this central region, is called the bregma. And we have the lambda. The lambda is like the opposite of the bregma, where the sagittal suture meets with the lambdoid suture at the back. Remember, we talked about the lambdoid suture separating the parietal and the occipital. Then we also have confluence points, which are points where sutures meet. One is the pterium. The pterium is where the frontal, the parietal, the temporal, and the greater wing of sphenoid that we talked about, that it extends to the outside to form the outer covering of the skull. The confluence point at the front is called the pterium, and in the pterium we have 4 bones meeting at this point, and these bones are the frontal bone, the parietal, the temporal, and the greater wing of the sphenoid bone. And we have the asterium. The asterium is another confluence point that is located at the posterior part, and it is where the parietal, the occipital, and the temporal bone meet. The anterior and posterior frontanelles are spaces that are located within the skull of the infant or the fetus. These frontanelles are incomplete ossification points, and at this region, the sutures are not completely formed. And that is why you have this opening. So we have the anterior frontanelle and we have the posterior frontanelle. The anterior frontanelle is formed between the frontal bone and the parietal bone. So around the sagittal suture and the coronal suture, you have this incomplete ossification point, which will gradually become ossified as growth proceeds. And we have the posterior frontanelle, which is the opening spot around the junction between the parietal bone and the occipital bone. The posterior frontanelle tends to close earlier than the anterior frontanelle. This closes 1 to 2 months, while this closes around 1.5 years. We've talked about sutures, the different distinct presentation that they show, the bregma, the lambda, the asterium, the pterium, the anterior frontanelles, and the posterior frontanelles. These are distinct presentations that are exhibited by sutures. These sutures present positive and negative effects. So let's try and look at the positive effect. Because they are fibrous points, and because they are still incomplete ossification around that point, especially in the case of the anterior and posterior frontanelles, they tend to enhance vaginal birth. During birth process, this head can be molded so as to allow their passage through the vaginal canal. Because there are spaces created within them, so they can be molded for easy passage through the vaginal canal. They also allow the skull to grow because of the space that is created within them. If they are completely rigid and there's no space for increase, as the content that is located within them, which is the brain, continue to grow, there will not be space for them to expand. But because of this space is created, they will be able to expand so as to accommodate the increase in the growth of the brain too. Then the negative effects that they present is at this point are very weak. So any form of injury or pressure that is subjected to this region may be dangerous. So they are prone to fracture. The cranial fossa. The cranial fossa can be seen when you cut off the skull cap, and what you see on the inside is the cranial fossa, and they are divided into 3 distinct regions. We have the anterior cranial fossa, we have the middle cranial fossa, and we have the posterior cranial fossa. If you look at them, you see that the posterior cranial fossa is the deepest. So this is deep, this is deeper, and this is deepest. So we try to study them one after the other to see what they present. The bony configuration of the cranial fossa. For the anterior cranial fossa, the bones that form the anterior cranial fossa are the frontal bone. Remember when we talked about the frontal eminence? So this is the frontal eminence. So the frontal bone forms the anterior boundary of the anterior cranial fossa. We have the ethmoid. We say the ethmoid is located on top of the nasal cavity between the 2 orbits. So this is the ethmoidal bone. And we also have the sphenoid. So the sphenoid is located just behind it. So we have the frontal bone, which take the bulk of the anterior cranial fossa. Then we have the ethmoid. Then we have this part of the sphenoid, actually, not the entire sphenoid bone. The middle cranial fossa is formed by the remaining part of the sphenoid bone. Then the anterior part of the temporal bone. This is the temporal bone region. We said that they form the deeper lateral side. So the middle cranial fossa is formed by the sphenoid and the temporal bone, while the posterior cranial fossa is formed by the occipital bone. That's no doubt the occipital bone and the remaining part of the temporal bone, which is the posterior part of the temporal bone. The content of the cranial fossa, what the cranial fossa contains basically are the brain tissue, but what region of the brain tissue? So the anterior cranial fossa accommodates the frontal lobe of the cerebrum hemisphere, which is understandable. The middle cranial fossa accommodates the temporal lobe of the cerebrum hemisphere. Remember when we talk about the sphenoid, the body of the sphenoid on top, we have the hypophyseal fossa, which accommodates the pituitary gland. Also, the pituitary gland is contained within the middle cranial fossa. While the posterior cranial fossa contains the brainstem, which include the midbrain, the pons, and the medulla oblongata. So this is the structure of the brain. You can see the frontal lobe, which is contained in the anterior cranial fossa, the temporal lobe, which is contained in the middle cranial fossa, and the pons, the medulla, the cerebellum, which is contained in the posterior cranial fossa. This is a task for us. The question states that what are the structural transformations seen on the petrous part of the temporal bone? When we discuss the temporal bone, we say that they are subdivided into two regions. We have the squamous and the petrous. We say the petrous undergo a number of transformations. So they have a lot of transformation that we can't talk about in this region. The second question is to describe the morphology of the ethmoid and sphenoid. So how can you describe what they look like? Describe the bones that contribute to the formation of each of the cranial fossa. Remember, we said that the cranial fossa can be subdivided into three: the anterior, the middle, and the posterior cranial fossa. Also explain different specifications that is exhibited by the sutures. We've described a number of them. Then you can write a short descriptive note on the morphology of the frontal bone. The frontal bone is the first bone that we discussed, and we say a number of things about them. So this is a task for us to do, and I hope that if we are able to treat all these questions successfully, then I think we are good to go. So thank you for watching. Let's meet in our next class.